with correctional officers at 27,005 and hired none to speak of. So now that we have our new pay plan, which I'd be happy to share with you if you so desire, then we feel like we can hire all the people. Okay, the pay plan has gone from 27,194 as the starting pay for correctional officer trainee to $30,347, and then after 6 months, that goes to $31,971. So therefore, even in the Delta or wherever, we're very competitive, and that compares with the positions we were able to fill with probation parole. So that's going to get us to where we think we can hire the people. That's going to be measured to the Justice Department, because when they come next week, I'm going to announce this to them. I'm going to be ahead of them. I won't say we're gonna, I say we are. We'll be doing it. So that's really big to them, because we've identified every problem we have with the Justice Department. For instance, new laundry equipment is going into the tune of $170,000 at Parchment. Totally redid the laundry because it wasn't adequate. We're now evaluating the air conditioning for the building at Parchment. It's going to be about $600,000. But all that's in the system and moving forward, because they're going to look at conditions of confinement. And conditions of confinement in the South is hot weather, hot times. So if we can just get the temperature to in the high 70s, I don't mean to do it like your house, I mean get it to the high 70s, then we've accomplished more to keep the Justice Department away. Our whole operations are geared to do that. And so from doing inmate letters to talking and communicate with inmates, and to also establishing mental health and depression treatment facility within the prison. They're working on that so that there'll be a dormitory set aside for inmates who are having depression and who are having mental health issues. Now that treatment will be under the auspices of the mental health department, but we're going to do it like you do alcoholism, a 12-step program. We're going to have inmates themselves who've experienced that before are going to be the ones that's doing the treatment. This is going to enable us to see a lot more prisoners, do a lot more people with mental health people, just managing that from a distance with these inmates really involved in carrying out the depression and mental health. Now, medicating, we will medicate the people who are depressed to try to cover that. That's a big issue in prison, especially with COVID. That changes the inmates' morale. At Christmas this year, never before had it been done, but every inmate got a little $5 bag of cookies and cakes and so forth Christmas Eve, so that you got a Christmas present. Well, that just blew morale sky high. We went through the Christmas season without any kind of incident, any kind of problem. See, contrary to what everybody expected. Now the probation parole has 3 tactical teams, 20 men each, that is well equipped and functional. We bought used school buses, 3 of them, so we could transport them together to any area where we had violence or any kind of uprising. We could immediately respond to it. One's at the north, one's at the central, one's at the south part of Mississippi. This is probation parole agents that are doing this. Now, we really on our way to getting this department turned around. The one thing that frustrates me a little bit is we have so many reentry bills, but we're going to do reentry big time. I'll give you an example. Our people at automotive mechanic would leave this prison with these little patches on their arm. You see this when you go into your dealer to get your car worked on. This is ASC certified mechanics. These mechanics make $25, $30, $40 an hour. This has been done before. We did this in Angola. We can do this here. And that's the kind of reentry we're going to have. We want to focus our reentry with 1,500 slots at the 3 major prisons. We want to keep the short-term inmates 5 years and less coming into the department. You know, that's where the reentry court's going to be if we pass legislation for that at Parchment. We'll also have that at CMCF, not reentry court, but reentry there. Also, SMCI. We've identified the schools, identified what kind of school each one will have. We will give the inmates an aptitude test like the military, not see what you want to do, but see what you can do, so our success rate increases. Then focus them that direction to reentry. So we don't want to do it at the regional and so forth because we can't afford the equipment. Now, $3 million we've asked for in addition to what we normally get out of inmate welfare fund. That $3 million is going to be designed specifically to buy simulators, how to drive the bulldozer. Women will have forklifts, how to drive forklifts, men too at other prisons, but the women have to have something. The women will have 25 welding machines, which will teach 75 women how to weld. And this will be a rolling classes. So we want something for everybody that possibly doesn't have a vocation, that leaves our prison system with a skill and a trade. I can do more rehabilitation. You can do reading, writing, arithmetic. You can do GED. But if you don't have one of these, you don't have a skill like this, a certifiable skill, you're going to get a job sweeping the floor. If you have this certificate, they'll hire you no matter what. You got a job waiting on you. And that's how we slow down recidivism, is by having real successful reentry programs. But they're going to be real schooled. It's going to be really schooled, and you can't afford it everywhere. So you got to focus all your money in 3 places. $3 million is not enough. It'll be enough for this year, and all we can get out and get in place, we'll probably ask for $3 more million next year of our inmate welfare money. So this is money that's not tax money, not appropriated other than through inmate welfare fund. The reason for the tobacco was to generate more money because they're going to do it anyway. And if it's legal on the street, why is it not legal in the prison? And so I never agree with that my whole career. If you're going to have it legal on the street, let it be legal there as long as it's not alcohol. So that's why the tobacco. We think we'll generate another $750,000 there to buy reentry equipment. So that's kind of how we're going as a quick overview. We're rocking and rolling. We will get to K9s and those things later. We take them one step at a time. We got to move slow. Don't be a shotgun too big. Just keep on going from project to project. I guess you've noticed you haven't been seeing the violence out of Parchment. And we just finished a research project from Baylor University with Parchment over our moral rehabilitation program that just came out. The book will be published shortly, and Mississippi is going to look real good. First research. We just kind of slid that under the weather because we'd already been working with Baylor. So there you have it. We'd love to answer any question you might have.
Well, let's talk about your budget. So your budget request. So where are we on your budget request?
Okay, I yield to my.
That's kind of what I figured you'd yield to your right hand.
Well, I guess you guys have gotten. I sent over this letter with these numbers, but we've had to ask for some more money, of course. What we intend to do, what we want to try to do, and we've, like the commissioner said, we've engaged Employment Security. They're on board helping us. We're engaged their division with their veterans trying to hear, but we want to try to fill, with the background being that we want to try to mitigate this DOJ thing and keep the Department of Justice from coming in here and spending our money for us. We're going to attempt to fill all of our vacant pens in addition at the new salary weight. By the way, this is the second raise we've already got the personnel board to approve one raise this year, and we had to go back because we couldn't hire officers at that rate. So we've got the salaries up to a point that I think is that we can recruit, we can hire these folks. And in the budget request, the amount of money we're asking for is we're going to attempt to, and I believe we probably can, fill all the vacancies we need to mitigate moving forward, and fill all the vacancies that we have now and fill the pens that were swept before. And of course, we were operating this year in a deficit situation, so we've asked for the money to get us back whole, so that with the medical shortfall and of course the regional shortfall.
How much is that deficit request?
The original one?
Yeah.
It's 30 million, I think. I don't remember the exact number.
And where is that going to? Or where?
The shortfalls
Yeah.
are going to be in it's in the private prisons, of course, the medical shortfall, and in the regionals. Actually, fortunately, when we asked for the deficit originally, we're 4 million less than what we originally asked for in the deficit. And that's simply because Tutwiler was, or the private prison in Tutwiler was the one who was driving that at that really expensive rate. We got really aggressive in reclassifying these folks, and we've got most of them out of here, and it's probably going to save us about $4 million this year just by getting those folks out of there. And I got a report just before we came over. It's they'll be gone, empty, completely out of there by the end of next week, probably. I think we're down to 41, down from 800 to 41 in Tutwiler, so we should be out of there completely.
Well, let me ask you on the regionals. Do you or do you not have capacity of MDOC facilities? Or in other words, there's been a push, a back and forth that I've heard on the regionals, and you said, I guess part of this deficit is to pay the regionals, if I'm correct. So we're spending this deficit for that. I mean, can you explain, which I think you may know what I'm talking about, but what's the status of the regionals versus what y'all's capacity is in-house, so to speak?
Well, okay, so I think I know what you're asking. What I would say to that is simply that if our staffing levels were completely full and we had everybody hired that we could possibly hire, we could probably take a lot of these regional folks and put them back into our system. But you see, staffing is the issue because you get an inmate to staffing ratio, and
if you're at full staffing and you take them back in, how much per inmate per day would that cost? If you know.
At full staffing.
At full staffing.
$40 a day.
And what do we pay the regionals? And what do we pay the regionals?
It's 31.
Okay. But I hear a but coming.
But that can be a little misleading because you just remember the regionals, they don't get the really bad inmates.
Okay.
And they don't get the really sick inmates. And those are the expensive inmates. So there's only medium custody at the regional facilities.
Yeah, we hear a lot that they can do it cheaper when they want our inmates, but they really can't because you do have to do the education, the reentry, and all these things are part of it, and you don't want to just house. And so it's in our budget to raise them to $31 a day. It was part of the budget. And so.
And how does, if you can give a general overview of how because we always hear about the costs of health care of our inmates. If you can give, and if you can put it in dollars, that's great. How much that costs y'all / the state of Mississippi?
It's about $80 million. It's $8.50 per inmate per day.
So you're saying around 80 million a year?
You got to factor in. So keep in mind that that's inside the gate cost, and we have outside the gate cost. So somebody gets really sick, we just sent an inmate last week. He got sick, he's got a heart condition. You have to send him out. He may go to ICU, and that's not covered in the contract that we have for our medical care inside the door. That's outside the door cost, and that's really expensive too.
Is any of that picked up by Medicaid?
I don't think so, because you have to be pardoned to do that. It's our cost.
So that's 80 million in state dollars.
Yes.
Okay.
Our medical contract is about 60 million, and that's worked really well. The new provider's doing a great job, and we're not having any issues with medical. And I went through about 100 letters this weekend, and there was not one of them pertained to medical. So that used to be that's all you heard. We solved the medical issue. The food issue is being solved because we'll be doing our own food by March. We save $1.5 million there, we think. And we're going to save about $5 million in overtime by filling the positions. So that's good. We deducted that from our request. Actually, $5 million was.
Okay, so I'm going to turn it over to Chairman Hobson, and then we'll move down the list.
Thank you, Mr. Chairman and Commissioner and Mr. McDonald. I thank you for the information and what you've been doing so far. I do want to, let me preface a question or two by saying I would like for the two of you to meet with Senator Wiggins and myself sometime fairly soon, because I've got your letter and I've got a copy of all the deficits and some other things that I want to go over with you in detail.
Sure.
In pretty short order. I've got a 3:30 meeting, so I'm gonna have to cut out of here in a second. But two things I do want to address. I want you to be thinking about. You don't have to give me the information. One is there is one proposal about county jails, and I think you even have a deficit about some reimbursements, about $2.5 million roughly on county jail incarceration during COVID.
Yes.
I want you to, if you know it now, you can tell me. If not, tell me later. What's a reasonable? Because you're probably going to be putting some of your medium to lower security inmates in the county jails. Have you got a projected cost per prisoner on that?
Per prisoner?
Yes.
I can get that for you. The total amount's about $2.5 million, so we just have to break it down.
If you could, and,
Sure.
and then let's talk about that when we have time.
Sure.
It going forward. Also on the regional, let me transition real quickly to that regional. I know we authorized to go up to 31 or 31 and change last year. Are you paying out 31 and change right now, or are you just you're seeking the money so you can pay that
That's
31
right.
and change?
That's
Okay.
right.
All right. I wanted to be clear on that too. And then the final thing is on the Tutwiler prison, have you moved all of those inmates to where have you put them? Back in Parchman some, or are you taking them to other prisons around the state?
Well, we kind of scattered them around. The vast majority of them have been gone to Wilkinson Correctional Facility because they were the ones that were left. They were reclassified. They couldn't go back into our institutions were the bad guys, and they went to Wilkinson. Most of them have gone to Wilkinson.
Well, let's continue that discussion. We have more time, and also talk about Wilkinson in general. I want to get back to that with Senator Wiggins and myself, just when we have 45 minutes or so. I may get you to get with Corbin and Senator Wiggins, and we'll arrange a meeting. But I do have some other stuff to talk to you about, but unfortunately I've got to run to another meeting. So, Mr. Chairman, thank you, and we'll get together soon.
Yeah, thank you. Okay, questions? I've got a couple, but I'm going to turn it over to any other members. Senator Jackson.
Thank you, Mr. Chairman.
Hey, Senator, pull that microphone, I guess, because we're,
Thank you, Mr. Chairman.
there you go.
Commissioner, how y'all doing?
Okay, good.
Okay, what did you intend on the regional jail as far as the level of the number of inmates per regional jail do you have planned for the future?
We have plans for the regional jail we're doing a staffing pattern now because we have to have the right staff to ratio for the facilities, and we want to be sure we're not over Parchman or at CMCF or SMCI for the Justice Department to have a finding. So we have the regional as a cushion kind of to keep shuffling around and keep them full and try to keep all of them above what we guarantee. And so we have run them up when we slow down Tutwiler. We reclassified inmates from Wilkerson. Those inmates basically went to regional if they were appropriate, and then that gave us a cushion there. So that's how we emptied it out in Tutwiler. So they play a major role for us, and we like working with them, but more for housing, and, basic education, Pell Grant education, and so forth, but not big-time major reentry programs because they cost too much. We want to run all that through our main prisons because of teacher utilization, because we want to use inmates and teachers as much as we can for skills and trades. Saves lots of money.
Thank you.
Senator Polk.
Thank you, Mr. Chairman. One thing I've heard in a few minutes I've been here is there is no box at Parchman in the prison system anymore. Y'all torn the sides down and you're thinking outside it. And I think that's going to make y'all very, very successful. I'm proud to see that. You mentioned medical care. I'd like to follow up on that just a second. When you send someone outside the prison system contract, you send them to certain hospitals, I assume. Do you have a contract with those particular hospitals? And is it as good as a Medicaid contract would be?
No, it's not.
Can we work toward that? If a hospital accepts Medicaid, why don't they accept Mississippi State prison dollars?
Well, yeah, that's a good question, but you know, I mean, inmates are inmates. We've approached the biggest hospital in the state of Mississippi, and quite candidly, they just want inmates.
That does not surprise me.
So, you know, yeah, we have some, and, you know, emergency care, they don't necessarily go. Most of our inmates will go to CM, Merit Health Central if they're not emergent at the time. So, and we've kind of talked to them some back and forth, trying to get them to adjust. They're just not real willing to do it right now.
All right, thank you. Thank you, Mr. Chairman.
I have one more. This 3 million from the inmate fund you talked about, that requires all legislation from us.
Yes, it does.
Is that in the authority? This authority. Yes. Okay, that's what I thought. It's authority. Okay, and so that's what you're asking is an additional 3 million in authority
That's right.
to take that from the inmate fund.
That's right.
To use that. Okay.
Part of that's gonna build we're gonna have a groundbreaking for our first church at Parchman tomorrow. And 70 days later, we're gonna have church in that building. That's gonna be right around Easter. And there'll be inmate pastors for that church, and that'll be a sign in the middle of the prison of more rehabilitation, for everybody to see the steeple and so forth. And then the second one is going right on this year. We hope to have another one at CMCF on 7/20, and then right on down to SMCI, have another one this next year. And also we plan to start the hospice program by July. That's going to save money, but it's going to be more humane for the inmates. And we will build a hospice chapel there so families can come in to be there, you know, at the last part of it, to have a place where they can sit and be there overnight and so forth, and accommodate them and be humane about it. So those things will be used from some of the money that we already have in the inmate welfare fund. That's why we need the extra 3 million, because those things have to be done as well.
Okay, and I've been doing some looking into it, and a portion of some of your dollars goes to fund drug courts. Are you aware of that, or is that the case?
You know, I know we will do reentry court, but we don't anticipate that costing very much money, because we already have the facilities and and so forth for reentry court. That legislation is pending. It will be introduced by the task force.
Okay. And when you say the reentry and all of that, that's the things, I guess I call it programs, but that's what you're talking about is the funding for those, the stuff you've been sitting here talking about.
Right, because it's like the front end alignment machine that you use to train people how to line their wheels is $22,000 just for the machine. So the paint and body shop, the booth is going to be like over $150,000. So all these things add up. That's why we can't afford them everywhere. That's why we got to maximize them and put them all in the same place. You start trying to put them at this place and that place and duplicate it, it's just foolish. It's not good. Not good business.
Okay. That's all the questions Senator Sparks.
Thank you, Mr. Chairman. Thank you, Commissioner. One question, you talked about a deficit appropriation. Is it related to the private prisons? It's a private management contract. There's not a private prison in the state. It's a prison that is managed by a private company, correct? And that's under contract.
Yeah.
So where was it, $10 million? What was the number for a deficit for the private management?
About 6 million.
6 million. What was the nature of being in a deficit request from someone that we have a contract with?
I'm sorry, what was that?
I was just wondering, how did we end up in a deficit with someone we have a contract with to provide services?
Well, it costs a certain amount to do that, right, in the year. And so if we're not appropriated that amount of money, then you run short, right?
Well, I think there were 4 contracts, and I don't want to get into weeds. I was just, because there was a deficit, we were in long-term contracts with each of these facilities with the company at, say, $38.72 a day. So we know what that cost is. I was just wondering, is the deficit in unseen medical expenses? Because it shouldn't be in supervision expenses, because that's a set fixed figure.
Here's what they would do. they
If
would,
I'm sorry, if I understand what you're asking is, because it's a contract, it's a set price.
Yes, Mr. Chairman.
So how can there be a deficit if the price is contractually set? Am I
And
saying that right?
that is correct, Mr. Chairman, with a fixed number of beds.
in the past, it wasn't. Because what would happen is, if you gave a raise to our employees, then they would want the money too, to pay theirs. I agree with you. And he does too. We agree that if we sign a contract and you say you're gonna take care of these inmates for so many dollars, it's not any of your business what we pay ours. You said you're gonna do it for that amount, so quit running over here and getting money. And so that's what they did though.
That's what was, I'm sorry to even, but that's what was happening.
That has happened. It's just like what happened with when they have a contract that you have damages if you don't maintain your staff at the level you're supposed to, but those damages weren't charged. But we have, to the tune of $230,000 we collected from WTC just for this year. Is that right? Hadn't been done before. So those are the issues that we correct, because if the contract says what it says, we're gonna live with what the contract says, no more, no less. That's what it is, isn't it? Contract.
That's correct. Thank you. And I knew those contracts were expiring this past summer, and I just wanted to make sure under the new contracts that we negotiated that was clear. If it's a fixed price, it's a fixed
Right.
price. If their labor costs go up, that's something they should have adjusted for.
Exactly.
Thank you, Mr. Chairman. Thank you, Commissioner.
Okay, any other questions? Well, that's, in the last couple of years, that's probably the most pleasant Department of Corrections budget presentation we've heard. So that's a credit to y'all. So thank you for coming and presenting to us. And we'll be talking, and Senator Hobson and I will get with y'all to get our meeting.
Whenever you want.
We're ready
when you are.
Thank you.
Thank you for supporting us. We have had immense support to turn this department around, and we really appreciate it. Unbelievable support.
Thank you, Commissioner. Riser, do I have a motion?
Right.
Rise and report. Thank you. Hey, Commissioner.